Good morning, ladies and gentlemen. This is Aisha Shahi from the National Health Insurance Company Laman, and I am part of the disease management team. Thank you for joining us today and welcome to our webinar on the vital topic of blood donation. 14th of June marks Blood Donation Day. This act of generosity is crucial for saving lives and improving health outcomes. Dr. Marina will take us in a journey to explore the critical role blood donation plays in saving lives and supporting healthcare systems. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end to answer your questions. Without further ado, let me introduce our presenter for the day, Dr. Marina Hamed Kazim. Dr. Marina focused her early practice at Sheikh Khalifa Medical City on internal medicine, radiology, and family medicine. Dr. Marina has gathered a broad yet deep skill set, bringing her passion and experience in medicine to her patients at Abu Dhabi Blood Bank Services, focusing on blood products and transfusion-related medical services. Dr. Marina joined Abu Dhabi Blood Bank Services in 2010. Dr. Marina, welcome. The floor is yours.
Hi, good morning, everyone. Thank you so much, Aisha, for that amazing presentation. So if I may share my screen, just give me a minute. Can everyone see my screen?
Yes, Doctor, we can.
Okay, great. So let us all understand about blood types. So everyone basically has a blood type, and all of us, we belong to one of four, either O, A, B, or AB. Okay, and knowing the blood type is important not only because it can show you who you can donate blood to, but as well who you can receive blood from. So this graph is a generic graph which will show you about all the blood types and which blood type can be given and taken. So we have O plus, O minus, B minus, B plus, A minus, A plus, AB minus, and AB plus. So all these types mentioned here, this graph can help you, so you'd understand who you could give blood to. Mainly,
Doctor, sorry to interrupt, but can you please present in a full screen mode, please?
Sure. Okay, is this fine?
Yes, that's perfect.
Great. Okay, so let me continue. So the main blood type, which is a universal blood group, is the O group. It can give to all groups, but it can only receive from the same type. So O negative is one of the rare types of blood, and which is mostly wanted more than O positive. So O negative gives to completely all, as you can see here on the screen. It gives to all the blood types. So O negative is mainly required during the emergencies. Usually this is mostly requested by the hospitals. Okay, let's go to the next slide. So let us talk a bit about the components of the blood. So what does the blood consist of? Blood contains red blood cells, platelets, plasma, and white blood cells. Each one has a role that they play in. Red blood cells carries oxygen to the organs and tissues, removes carbon dioxide from the body through the lungs. It's used during the emergencies, surgeries, and cancer treatments. Platelets provides basis for the clotting, helps control bleeding, used in patients who are having bleeding disorders and cancer. Plasma, it's a liquid component, carries the nutrients to all parts of the body, carries the waste products out of the body. It acts like basically like a cell transportation system. It's rich in vital proteins, treating patients who are undergoing extensive surgery or trauma, patients who have bleeding disorders. White blood cells, they protect the body from infection, is very well known. They can also carry the viruses and bacteria, and because of this, they are removed from any of the donated blood. So we make sure that they're not consisted together. We filter it out from the blood donation products. So types of donation, we have whole blood, which is the most flexible type of donation. It's transfused in its original form, used to help multiple people when it's separated into the specific components of red cells, plasma, and platelets. This type of donation you can donate every 56 days, every 2 to 3 months, okay? And the process takes about 20 minutes. Apheresis donation means platelets donation and plasma donation. So this allows the donor to give specific blood components, okay, such as platelets, plasma, and as well red cells. So basically packed red cells. So the packed red cells can be donated every 4 months, but not more than 3 times a year for the males, okay, since it takes about 45 minutes, the procedure. And plasma can donate every 2 weeks, not more than 24 times a year, and donation process takes about 30 minutes. The platelets can donate as well for 2 weeks, and you should not do it more than 24 times a year. And the donation process takes maximum up to 1 hour. Okay. The requirements to donate the blood: you have to be a resident of UAE, having a valid Emirates ID. You should not have donated blood within the past 56 days. Your weight must be at least 50 kilograms, and your age should be between 18 to 65 years of age. We do take those who are 17 years of age, but they have to have the guardian with them. Their legal guardian should be available with them so that they can present their Emirates ID and they can fill the form, which is, for the legal matters, because the legal age is 18. But we do take those who are 17 years old. If their health is good and they're able to donate, we just make sure that their guardian is with them, and we take the approval of the guardian when we take their blood. Those who are above 65, we do take as well according to their health status. If they are of good health and not taking any medications which will defer them from the donation, and they're in a good condition, then they can donate. The blood donation process is very simple. So first of all, we're going to start from the right side. So first of all, we'll get the person would register. So we would go over their basic eligibility to knowing if they have donated before or not, and when was the last time they donated, what is their blood group, and they will also have to show their Emirates ID in order to record all this data. So once the registration process is done, they get to have a free medical checkup. They will answer some questions like the medical questionnaire about their health and history, if they're on any medications, if they've traveled. We focus a lot about the travel history due to the malaria and the dengue, which could be it could affect the blood donation process, and any medications. And we check the temperature, we check the blood pressure, making sure that the person is fine, they had enough sleep, they had their breakfast, they had something to eat and drink, they're doing well, no anemia. The hemoglobin levels is very important to check, making sure that they're fit enough to donate. And then once they are cleared from the medical side, then they go for the blood donation, which takes about 8 to 10 minutes. They'll be laying in the bed comfortably, and they will have the site cleaned extremely well and sterilized very well. And then they will have the needle inserted into them. Each pack contains its own needle, and it's disposable. It's pretty safe. It's pretty sterile process. And then once they're done, they have to rest for about 10 minutes onto the bed, making sure that they're not having any dizziness and they're feeling fine. And then after 10 minutes, they can go and have something to eat and a snack, and then they can go home after that. Usually one unit can help about 3 lives. So hospitals request for the blood based on different needs after the testing, and ensures that the blood is ready for dispatch. So all the units which we have taken has to go through the testing process every single time, and we make sure that they're not carrying any viruses or any bacteria that can cause a problem, or it could be transmitted to the patients. So we are extremely careful in everything that we do, and we make sure even the testings is correct. And if we see any issues on the test results, we straight away inform the donor and we counsel them. And if they need referring, we refer them to a physician who can manage their condition, and then they would be done from blood donation. So it's according to the results. And if everything is fine and they have no issues on their test results, then they can come back and donate with us again. So what are the benefits of donation? There are many people who ask us these questions, and what is it beneficial for me? So it's not only that the blood donors are benefiting from the donation. The blood donation makes also it gives life to the receivers of the blood. So basically you are supporting and helping those patients who are in need. Blood cannot be made. We cannot create blood basically. So it has to come from donors because that's the only way we can have blood given to help others. It helps the donor maintain good health. So first of all, we test the blood and we make sure that the person is fine. So this is beneficial for the donor so that they know that their blood is healthy and that they're fine. So when they can donate, that means that they're healthy enough to donate. Plus, it helps to stimulate the blood cell production, helps reducing the iron overload. So there are some people who have a lot of iron overload, which can affect them and their health. So it is healthier for them to donate the blood, to making sure that they don't have overload. Stimulation in the blood cell, it stimulates the red cell production, the plasma, the platelets. So this is really good. It helps the bone marrow. This is extremely vital as well, and it helps oxygen, and the blood to be circulated into the body. And some of the studies had showed that donating reduces the risk of heart and liver disease. It lowers the risk of cancer and it lowers the cholesterol levels. So it's pretty important that everyone should take this up as an act of humanitarian effort, and as well as a service to the country. It's very vital to help the patients, because every single day there is someone who needs blood out there, and it's a lot more than we think. So we usually use about, we can give about 100 units in a day to someone who might need. So it's really important that we encourage everyone to put hands in together and help our patients. So who benefits from the donation? So anyone who needs blood, who basically will benefit from the blood unit that you donated. So accident victims, fire victims, anemia patients who have thalassemia, sickle cell, hemophilia, women with complications of pregnancy, ectopic pregnancies, hemorrhage before or during the childbirth, patients who have bleeding disorders, as I mentioned, patients undergoing surgeries, cancer patients, organ transplant patients, newborns with birth complications. So imagine so many cases that we can have, in the hospitals, they are requiring your blood donation. So this is something that we should continue on, and we should make it as a good habit and donate regularly. So please note that we do not support the practice of direct blood donation due to risk of associated, the risks that are associated with it. So basically there are a lot of families who come over sometimes and they say, we would like to donate our blood, say, to a specific person. We don't do that anymore because there could be some discrepancies or some blood disorders or blood test issues that can cause other issues. So we prefer whatever is available and has been already tested and is safe for supply, is we give that to the patient, whatever they need. It is much better. So we stick to that. So just to get an idea of how much blood is needed in a certain case. So basically for heart surgery, person could need up to about 5 units. And if those who are in car crashes, sometimes they can need up to 50 units. So it depends on the situation of extreme blood loss. So imagine this is something severe, and sometimes things happen, but we have to be extremely prepared. We have to be well prepared. We have to be there to make sure that we have enough to give. Those who are having cancer treatments, up to 5 units, and those who have leukemia, sometimes up to 8 units per week. So they are our regular patients, usually from the hospitals, who are requiring. So we always have to come up and make sure that we have enough to give them. Where do you donate? We have different facilities available in the country. We have in Abu Dhabi, we have blood bank in Abu Dhabi, we have blood bank in Al Ain, we have a blood bank in Al Dhafra, we have a blood collection site as well in Makani Mall in Al Ain, and we have different locations, mobile blood banks in Al Ain, Abu Dhabi and Dhafra, and you can find out about the locations. You can call us at the blood bank and you can find where would we be closer to you, so you could come and donate donate. And we have as well on the Google Maps, you can have a look at the Google Maps, we're located there. And as well, sometimes we would post, for example, about any blood drives which would be coming up, or any other updates. Follow us on that. And thank you. So I am here. I'm open to any questions that anyone has.
Thank you, Doctor. Thank you, Dr. Marina, for such an informative presentation around one of the most vital topics. Now we will be moving to the audience question. And Doctor, the first question that we have, what steps should I take to care for myself after donating blood?
Okay, so after a person donates the blood, they have to make sure to eat and drink very well. So when you have, for example, when anyone goes for an exercise, okay, when you exercise, you've got to replenish what you've lost. So when you sweat, you lose a lot of salts, a lot of magnesium, potassium. So everyone has to have rehydrating salts to making sure that they fill up, for the loss that they've made, and as well as protein, because, muscle is using protein. So it's the similar composition, similar thing. So after donating the blood, making sure that you drink enough water and that you have a good healthy food, vegetables, fruits, go to normal diet, making sure that you follow up, not one meal a day, focus on 3 main meals a day with healthy snacks in between, making sure that you replenish the blood that you've lost, okay? And have good rest as well, and making sure that you exercise the same day of the blood donation. This is extremely important because, the opening of or the venipuncture, the site where the injection being placed in, it's a little bit bigger, so it takes some time for it to close up accordingly. So we don't want you guys stressing yourselves out, because it's already an effort when you make the donation. So that day you have to give yourself a break and rest. No hard exercises, no carrying anything in the arms, no standing outside in the sun or for long hours, making sure that you're resting well in the cool, making sure that you're having enough food and drink, okay?
Mm-hmm. And Doctor, is there like any specific food or drink that can help me recover quickly after donating?
There are many vegetables which you can as well, like in the nutrition side. So you have beetroots, which are very helpful. You have apricots, you have figs, you've got nuts, you have pomegranates, you have raisins as well. These are all really healthy, and they can help to increase the iron in your body. You have spinach, you have lettuce, cucumbers, all these watermelon. These are all also good with good quantities of water inside, so it can help to replenish and hydrate you as well. So just make sure that you have the right kinds of vitamins, the right kinds of fruits and vegetables to help you recover.
Mm-hmm. And Doctor, moving forward, can we donate blood after doing hijama?
Yes, but not immediately. You have to wait at least 2 months. So say, for example, a person has done hijama, they have taken a lot of cups, for example, like 16 cups. So I would advise them to wait 2 months, and then they can redonate again. But if someone has done, for example, dry cupping, which is hijama, but it's like without removal of the blood, it's just using the cups as a massage, this is okay. They can donate, no problem. But as long as the blood has not come out, that's the only thing.
Mm-hmm. And Doctor, how is donated blood stored, and how long can it be kept before it is no longer usable?
Okay, so we can store the blood for many months, but usually it doesn't happen because whatever we collect and we test, we already give it and send it out for those who are in need. We don't have literally, and we do have some stored for extreme emergencies, but I don't think it would be useful after like a certain time, like after a couple of years. So it can be stored up to 3 years, but then of course the quality is not as high standard compared to a fresh unit or a unit which has been kept for a month or 2. So there's a huge difference, of course. So we all know this. I mean, it is obviously better to have fresh and blood which is constantly coming in. I would prefer having that. So than stored blood which is kept for many years. It's obviously way better. But yes, we can store it up to years, depending on the product.
Mm-hmm. And doctor, should I avoid certain activities before or after donating blood?
Before donating, it's fine. There are many people who do exercise before coming and donating, especially for those who don't want to miss, for example, if they have a schedule that they follow and they're not able to exercise after the donation. So they do their exercises and then they come and donate, which is fine. At least they would be relaxed after that. So after donation, they're not allowed to exercise. They can do it the next day, basically, and making sure that, as I mentioned, not carrying anything heavy in their arms, not standing for too long, not standing out in the heat, not being under pressure. They need to relax that day.
Mm-hmm. And doctor, moving on, are there any psychological benefits associated with regular blood donation?
Psychological benefits, I'm not sure, but there are many people who feel good, as they say, it makes them feel better, like they feel freshed up, basically. So maybe this is more of a physical feeling than a psychological feeling, but as well, many people do say like they feel so good by them giving blood that they help others, and this makes them feel good that they've done an act of kindness. So yes, it does impact as well, if you think of it in that way, that you are helping someone, and just by doing it, it's just like you've done sadaqah. So like, when you've given a dirham to help a poor, basically, so it's the same feeling that you've given blood and have helped someone that day, because you could have helped a child, you could have helped an older person, you could have helped somebody who needed you that day. So it does have a very good psychological feeling that you've done some service to the community.
Mm-hmm. And doctor, can I donate blood if I am taking thyroid medication?
Yes. Thyroid medication has no negative impacts on the blood donation. You can, but those who are taking iron tablets, for example, yes, we prefer them not to be on iron. And they need to finish the course of their iron tablets and then wait for a month. So then we can just recheck their blood again to making sure that we know the original type, the original level of their hemoglobin. And then once they are stable, then they can donate, but not to be on iron, because it will show us a false positive number as they're already on iron. Maybe they're actually deficient.
Mm-hmm. And can individuals with chronic conditions like diabetes or hypertension donate blood?
Yes, as long as the hypertension is controlled, if they're on their medications and they are controlling their blood pressure, we can take. So we have a certain number that we follow. So up to 160, 180 systolic, we can take. But it should not go above 180 systolic, and diastolic should not be more than 100. So I usually, in the blood bank, if I'm there, they will communicate with me, and then I will follow up and see how is the person's health. We'll ask them to relax a little bit, take some fluids, and then we try again after a few minutes, 15 minutes, for example, and ask them to calm down, take deep breaths, and then we recheck the blood pressure. So making sure that the blood pressure is in control, making sure as well as the sugars in control, that you're taking your medications on time and you're having healthy food, and that you're following up on your sugar levels, and they're not going above like 200 or 190. So making sure that it is stable.
Mm-hmm. And doctor, can someone with tattoos donate blood?
They can, but it should be at least 6 months over that they have done it, not within that 6 months. So even if it's touch-up tattoos or an actual newly one done, they have to make sure that it's not been less than 6 months. Should be more than 6 months.
Mm-hmm. And doctor, someone is asking, I want to donate blood as a good habit, but twice it happened with me while giving blood. I felt unconscious during blood donation. What could be the reason? And could you please specify, do I need to do any test to know the reason?
Okay. there are so many different cases. There are people who not just faint after blood donation. There are people after they see the doctor with the white coat, they pass out. So this is psychological, and it's happens because a person has fear of something. So sometimes there are people who just look at the blood and they just faint even before actually donating. So there are different cases. So if you're the type who is having fear, you need to inform us, the physicians in the blood bank. We will help to make the process smoother for you. I will accompany you before you donate blood. I will be supportive. I will make sure that you don't feel afraid of anything, and I will occupy you with talks until the time you will finish. So just to making sure that everything goes smoothly with the donation. Sometimes as well, it can happen that people who have not slept well or who have not drinking enough fluids or not eaten, these can cause a problem after the donation. They might feel dizzy and they might faint, as well as if it is a first time, it can happen because the body is not used to that amount of blood, which will be coming out, in such a fast time, like within 15 minutes. The body has to get used to it. So after second, third, fourth time, the body gets used to this kind of habit, and then it becomes normal. So don't worry, it's a pretty normal situation that when it's just like sometimes when you eat something new, your stomach gets irritated. You're not used to that food because your body's has not been taking it on a daily basis. But then when you start educating yourself in the sense of going on a certain lifestyle, on a certain habit, then your body gets adapted to it. So it's the same thing.
And doctor, someone is asking, I went to blood bank before to donate blood, but they refused as I have small veins. What is the possible way I can donate blood?
Okay, well, it's a challenge. Not everyone has the same vein patterns. So it's just like, the fingertips on your hands, we all have different patterns for different people. So subhanallah, this is a creation which we cannot judge on. Everyone has differences. So it's as well, the vein patterns which are in your body is totally different than others. Some will have small veins, some will have bigger veins, some will have in middle. So it actually would depend on that, and as well as if you exercise. So say there are people who don't do any weightliftings, for example, or they don't work with their hands. They're very sedentary in the hands. So basically the veins become thin and small because of not being used, or there's not much of pressure or pumping in the blood veins to do that. So my advice would be try to work more with your hands, work at home, or use a stress ball, at work, just to keep pumping your hands every now and then to just keep the veins going and the blood pumping into your body. This could help give a good exercise for your veins, but it doesn't always work out that it will become bigger. So don't just stick on my words, because it could be this is how your body pattern is. So give it a try and see after a couple of months how it is. If it gets better, fair enough. If it doesn't, then know that this is the way how your body is, and maybe you're not you can't give blood, but you can do other things. Voluntary works, there's a lot of things that you can do to help others. It's not just by giving blood. There are so many other things you could do.
And doctor, how do medications I am taking affect my eligibility to donate blood? So is this like certain medication that if the person is on, they cannot donate blood?
Yes. So basically, if a person's not feeling well, they have a sore throat or any kind of flu or fever, and they're on antibiotics, for example, the antibiotics will definitely defer you. We can't take, because there are people who have allergies to medications. So patients basically can have some allergic reactions to the medications that are involved. So therefore, we make sure that they are not on any medications that can cause reaction. So antibiotics is one. Another thing is those who are taking medications to reduce their immune system, like systemic lupus, for example, those who have they're taking treatment for certain cancer, for example, other kinds of medication like blood thinners, which will, like warfarin, which they need to take it for a long period of time due to some cardiac problems. So these are medications which we cannot accept. So we have a list of medications which we don't take, and they are on our on our landing page, on our web page. So I think we had posted that on where's the how to contact us with you can find out all the information on there. Even we have on the Saha app. So if everyone has a Saha application, you can open the Saha app and you can find an icon which shows about blood donation. When you click on that one, you will have all the information that you need about the blood donation. Also, it will show you about your the rights and responsibilities, what is the process, and as well as the eligibility. If you're eligible, it will show you also the kinds of medication which we don't take.
And doctor, about drinking, consuming alcohol, smoking, and donating blood, can we do that?
For the alcohol, it will depend on the type of alcohol and what time it has been consumed and how much. So we usually ask these kinds of questions. These are very important as well. And the person actually should be sober, should be, it should be cleared from their system before they donate the blood. It would be better, because most importantly, that the person should be in his state of mind even after drinking the alcohol. He should not be drunk when coming to donate the blood, because of course this will defer him. He will not understand what is on the medical questionnaire, and this will also defer him as well, because the amount of the alcohol will be extremely high into the blood. So it will depend on the day. If the person had drank, they need to inform the medical staff how much they have drinken, what did they drink exactly, and what is the quantity that they've drinken. This is important for us to ask. Smoking is fine, but as long as they have not smoked before the blood donation and after the blood donation. So we advise to give a gap of at least a couple of hours before and after the blood donation to stay away from smoking. And we, of course, we prefer that people will cut or quit smoking, because it's not healthy. It does not help the body to get in oxygen and to help the body to recover itself. The process will take even longer. So if you're a smoker, it's going to take much longer for your blood to really recover, because you're not allowing the oxygen to get in because of the smoking. So we prefer people to stay away from smoking in general.
And doctor, during the presentation, you mentioned something about iron overload. Can you please explain it more?
Okay, so sometimes we have cases in which people have very high amounts of hemoglobin or iron stores, and this is a blood disorder. It's called, so basically in this case, we to make it in a simpler manner, so those who are having this kind of blood disorder in which it's in the family, and they get a lot of a very high amount of iron storage. So in these cases, they need to have their blood removed and as a therapeutic. So in these cases, we don't take them, because usually their hemoglobin levels come above 20, and our maximum that we take is 18.5. Okay, so if it's over 18.5, we don't take, and we refer them to hematologists, in which they do the therapeutic venesection. Okay, until it comes to a certain degree that it is calm, it's back to the normal, then we take. Some people as well who are smokers, heavy smokers, they come in with high hemoglobin levels. We take them, but not more than 18.5. Same thing, if it is more than 18.5, then they come and they sit with me. I will go through their CBC results. I will make sure to knowing what is the condition of their blood exactly. Do they need to be referred to hematology? I will refer them to hematology, then they will do the venesection, and then they will be sorted out in that sense. And then we will see whether they can come back to us again to donate or not, depending on the case.
And doctor, is traveling to certain regions around the world affects the ability of donating blood, and what are these regions?
Okay, so those who have donated with us many times before know this. This is mentioned on our medical questionnaire. So those who are coming from malaria endemic countries, who also have dengue fever. So these are the places, as well as the West Nile virus, as well as you know. The Zika virus as well. So all these countries, which is the African countries, Asian countries like India, Pakistan, Afghanistan, Thailand, Nepal. There are like a list of countries. So they can also have a look at it when they are coming for the medical screening. We have like a whole list of countries, and if they have been to any of these, they need to inform us beforehand, and we will defer accordingly to the time. So since the time they have entered into the country should be, if it is their first time in the country in UAE, they need to wait 3 years in order to donate the blood if they're coming from malaria endemic country or dengue. So at least 3 years. And then if they are a regular citizens here in the country, they can after every 3 months. So if it's the time they have been here in the country according to the travel. So they should be 3 months or more in the country in order for them to donate.
And doctor, for our last question, generally, is it a painful process?
Well, I will say this, nothing in life is painless. Everything in life is painful. So I can say that this is nothing compared to childbirth pain. So don't think about it. I mean, I would rather go for a needle prick, but not go through childbirth. So childbirth is probably one of the most painful things that anyone can ever go through, because it's not just a few seconds of pain. We talk about hours of pain. So that is like way up there in the line. So it's not so bad. It's just, it's just a prick, and it's just a couple of seconds, and then you'll forget about it. But don't think about it. Just think about the act of kindness, and think about how many people you're going to save that life, and those patients, how they will pray for you, and they will appreciate, that this blood has come to them to help them, and all the good things that you've done, you will get rewarded and blessed for that.
Indeed, doctor. Thank you, Dr. Marina, for such an informative presentation around one of the most viral topics. Thank you, doctor.
You're most welcome. Most welcome.
Dear audience, this is the end of our webinar. Please take a moment to answer the survey questions. Your feedbacks and input are appreciated. Moreover, you can view the reply of the current webinar and as well as previous webinars in our YouTube channel, Dhaman Insurance. Thank you for joining us today, and special thanks again to Dr. Marina for your valuable input. Looking forward to meeting you all at our forthcoming webinars. Stay safe, and wishing you and your loved ones a blessed Eid.
Thank you so much, Aisha. I so much appreciate that you have invited me to this webinar. Please don't forget to send out to everyone my email address and my office number in case you guys have any personal questions, you have something that you would like to talk about. I'm always available to answer you. Thank you so much, everyone. And I'm hoping that we have a good turnover today. So please, all of you, come and donate. This is the time we need you. Thank you so much.
Thank you, doctor. Have a nice day.
You too. Thank you.